I'm Dr. Craig Buhler. I'm a chiropractic physician, and I'm the developer of a technique called Advanced Muscle Integration Technique. It's a new cutting-edge approach to the assessment, diagnosis, and treatment of athletic injuries. People come in here with all kinds of conditions. They've tried everything under the sun. They've been to the best clinics in the country. A lot of them had surgery, and they're all struggling. They're just looking for answers. What Advanced Muscle Integration Technique gives people is hope. When you have a pain, it's your body's way of telling you that there's a problem. We define the source of the problem. We answer the why question as to why people get stuck in the rehab, why people seem to have particular problems, why people have pain in an area. If a vertebra becomes fixated or jammed for whatever reason, if that's not manipulated back into motion, over time, the local tissues around that nerve root can become irritated. Once the nerve root's affected, it affects the nerve control to those tissues. If it's a muscle, the muscle starts to weaken, which leads to injury and or disease. The way we address that is, first off, we test each muscle for function. Pull tight. So I'm pulling you down with the tip of one finger. If the muscle's not working, that muscle drops down, it breaks, and the patient feels pain. We basically reinitialize that muscle system back into the central nervous system. It's like the body says, oh yeah, I remember that one. And once we do that, your pain goes away. Pull tight, pull it. Nice. When it comes to human performance, it's really important that those muscles fire in a proper sequence. And if the body's trying to adapt around a muscle imbalance due to an old injury, it affects your performance. Don Sparks, a trainer for the Jazz, came over to my office and interviewed me, and I worked on some problems that he had and solved them. That was my in with the Utah Jazz. So that following season, they officially named me as their team chiropractor. You asked me if you had to believe in it for it to work.
If this was faith healing, we were in deep trouble because I wasn't a believer.
That's true.
For sure. I played 19 years with the Utah Jazz. My first year, I didn't use Craig Buhler at all. I watched other players use him, and to be honest, I thought I was a little crazy. Real breakthrough with him came, I don't know, 2 or 3 years later.
We're on the road in a playoff game.
Front court left, Stockton falls down, and Stockton is hurt.
That was a very severe sprain where my ankle rolled all the way over onto the ground.
The worst ankle sprain I've ever seen.
I consider myself fairly tough, but I was carried off the floor. I had guys underneath both arms and kind of hopped off on one leg and thought I was done for that road trip and beyond.
We went in the training room. I manipulated the joint back into motion. Within 3 or 4 minutes, he was running in the training room pain-free.
All of a sudden, all the tests of the ankles, all the perineal muscles, everything became stable and online, and it didn't hurt anymore. It wasn't shaking uncontrollably like it was when I went in there. And I went right back out and played. People can see, they say your adrenaline's going, there's placebo, there's all these things that go into place. But the next night, I was able to play a full game in Miami on an ankle that was severely sprained that night.
That would have been an injury that would have kept him out for 6 to 8 weeks if he had been managed with the standard medical protocol. Over that 24 years, we had the lowest player missed game due to injury rate of any team in the NBA. We had seasons, we only had 11 player missed game due to injury for the entire season. I mean, that's unheard of.
He was a huge part of my success, being able to just go out there and play healthy every night.
Stockton, open three, hit it! John Stockton sends the Utah Jazz to the NBA Finals.
I look around at other people my age, and I'm moving around pretty good for a guy that put that many miles on these legs. I know the benefits of what Craig's doing, and I've lived it and still am living it. I feel like I have a responsibility because of what I know about it and its healing effects to not just let people go down that other road.
Okay, push tight. See, because I'm not applying much force, but you're having a hard time controlling that, right?
Mm-hmm. I play basketball at John Stockton. He's an assistant coach for our program this year. I've always had a lower back pain.
Now we're going to test your low back muscles. You have to contract the low back muscles here to stabilize your pelvis.
Mm-hmm.
Okay?
Okay.
Hold tight. Try again.
I've gone to physical therapists and done all kinds of work on it. I would have relief for like 2 weeks, but right after that it would just go back to pain.
I was diagnosed with compartment syndrome.
Compartment syndrome is a condition where calf muscle is so tight and the pain is so intense that medically they just go in and cut the sheath to decompress it.
My first option was surgery. That's what the doctors told me. Cut open your legs, and he's saying, no, it's your muscles and you gotta get your muscle functions back. If I have like all my functions back, I should be able to exercise, run, jump, everything I need to do to play basketball without having constant pain, and to have the option not to do surgery is like always the best way to go.
If you get a surgery on something, you're bound to be sore and stiff, and you're gonna be out and then rehab and then come back and you might be where you were. He's actually saying that you're gonna be better than where you've been.
Those girls were afraid they couldn't play the season. We worked on them for probably 3 hours each total. They left completely pain-free. And they look at me and say, is that possible? Yes, it's possible. It happens every day here. We had another snowboarder from Spain come in.
I compete in the elite level on the freestyle side of the snowboarding. And yeah, I've been in 3 Olympic Games. I've gone through a lot of injuries and a lot of crashes. It's a limit on your performance. I didn't know that these injuries were possible to fix until I found out about Dr. Buhler.
The thing that was most impressive to her coach was that her timing and her coordination on her routine was so much better, simply because she had better function of her muscles.
It will be something that we constantly monitor towards the 2018 Winter Olympics.
It's about the athlete and what's best for the athlete to improve their performance, to prevent injuries, to predict injuries. It breaks my heart when I see an athlete whose dream it is to make an NBA team or make a college team, or an athlete whose dream it is to make an Olympic team, that fails to meet that goal because of a chronic injury that won't get better. My job is to help people get their bodies back. And if I can do that, then I don't only give them hope, but I also give them their vision back of what's possible.
I'm a medical doctor. I was very skeptical of really all alternative treatments. I was a runner at the Division I level in college. I had a series of injuries, broke down. The condition that I had, which was plantar fasciitis. And by the time I started medical school, I wasn't really able to run anymore at all. I did everything that I could have done. I did rest, I took the medications I was told to, I did physical therapy, and ultimately decided that I needed to have surgery. And the outcome of that was very poor. And ultimately ended up in a wheelchair. I was truly hopeless. I had left my residency program. I was, essentially unemployed in the standpoint of I trained to do a certain thing and I couldn't do it anymore because I was in so much pain.
He'd had a couple of really significant surgeries that didn't work out. He was so broken down because of the years of challenge that he had. He flew all the way from Michigan.
Talked with him and really tried to understand what it is that Dr. Buhler does. Coming from my background, it made very little sense at all. I was extremely skeptical. Truly the first time Dr. Buhler spent an hour with me, I started to notice that something was different. I stood up for the first time in 2 years without searing pain in my feet. I really pinned him down and pushed him to show me objectively that things were changing, in between my pain and true objective measurements and be able to see with my eyes changes in my own body. I could literally see a physical difference in my feet. The height of my arch of my foot was different. The tone of the muscles in my feet was different. And that was astonishing to me. I'm able to walk now for an hour a day. To have that pain relief was just extremely valuable to me.
It's miraculous, the changes that occur. I've had people coming in from all over the world. I've had people coming in as far away as Abu Dhabi and Dubai. Big difference between here and Abu Dhabi.
Oh yeah, the cold, we're not used to it. I ruptured my Achilles tendon playing soccer. I've hit a plateau in my recovery process. I could just, let's say, jog for 10 minutes and then my tendon becomes stiff. Within 3 days, my tendon has become better than ever. The difference is just amazing. If Dr. Buhler was in another planet, I'll go.
People are starving for that understanding that translates from a doctor to the patient. And in that moment, they get a glimmer of hope. that possibly this doctor is going to be able to help me.
His hands are healers. He is a natural healer. Just to watch him use his magic and to see what he does with his innate and inherent ability to heal is extraordinary.
The method is amazing, and he's just taken it to the nth degree. To be able to turn a muscle around, the function around within minutes is, really quite remarkable.
I've been working with him now for the last 2.5 years. I've seen him turn people around. I've been one of those people. My daughter's been one of those people. It's been an amazing experience.
A breakthrough occurs in those aha moments when we see something from a whole different perspective that gives us the opportunity to move to a whole new realm of possibilities. We are getting impeccable results with this approach, and we're changing lives, and we're giving people hope again. We're allowing athletes to dream again, and there's nothing better than that.